Bismillah ar-Rahman ar-Rahim. Good morning, everybody. Highly welcome in this morning, and I'm very glad to have one of our distinguished professor in the field, Professor.Ahmed Abdalla Agab, to talk about a very important topic in these days, dengue fever. Professor, please welcome, and the floor is yours.
شكرا جزيلا دكتور دسوقي. شكرا للحضور. Dengue fever is an important topic simply because it is the current nightmare of many people, particularly in this part of the country, making a lot of inconveniences and worries. So we'll talk briefly about the topic with a bit of details on the correlation between the pathology and clinical manifestation, and then we'll end up with how to treat cases of dengue fever and how to prevent and control dengue fever. So dengue fever is an acute febrile illness caused by a virus. This virus is called dengue virus. The agent of the virus is the dengue virus. It belongs to this family and to this genus, flaviviruses. Flavi means yellow, and this is an important genus of viruses to us because one of the members of this family and this virus is yellow fever. So can say dengue virus and yellow fever virus are cousins. They belong to the same family. However, dengue virus is much more benign than that yellow fever. Dengue fever has 4 serotypes, the 1, 2, 3, and 4, and it is an envelope virus. It has got 3 major proteins, that these are the antigens, and it is a single-stranded positive sense RNA. So, this is important because being an RNA virus means when it enters the cell, it doesn't have to go to the nucleus to replicate, to make viral proteins and virals. And being positive sense means it doesn't have to make messenger RNA. So the viral genome itself will function as a messenger RNA. So once the virus is internalized, it will go directly to the host cell ribosome and it will start synthesizing viral proteins. The infection can be fatal. Any one of the 4 serotypes can cause severe disease. However, infection with one serotype will give a lifelong immunity to that serotype, but it does not protect against other serotypes. On the contrary, when a second infection with a different serotypes occurs, the disease tends to be more severe, and this is called antibody-mediated enhancement. Then we talk a bit about the vector. This is the vector. She's the Aedes aegypti and mosquito. And طبعا you have other two mosquitoes around, Anopheles and Culex. This is a bit different from both. So, as in all other insect vectors, it is the female that is causing the disease simply because female needs blood for ovulation, and therefore it has to feed on blood in contradistinction to males who do not make eggs or ova. One of the differences between this mosquito and other mosquitoes, it is a daytime feeder. So it bites during the daytime. Usually it is active early in the morning and late in the afternoon. And this is important in designing control programs, particularly spraying. This is a suitable time for spraying. This, and of course, this is in contradistinction to other mosquitoes like Anopheles and Culex, where they are active during the night, dawn and dusk, and بالتالي this is a suitable time for spraying. What is again peculiar about this vector is that it loves to stay close to people, and therefore it is very much related to urbanization. And people think, urbanization is one of the factors that has led to the spread of this virus. It doesn't live in jungles or away of people. And it lives mainly in houses. ولما نقول indoor معناها either in houses or in offices and working places. And this is important because other mosquitoes are only hazards during the night time where people are at home. But this bites during the daytime where people are at their working place. And this is important. They lay eggs. The individual Aedes aegypti mosquito, they lay eggs 3 times throughout their lifetime. Usually the lifespan is about, say, 21 days to 1 month, depending on the environmental factors. During this time, it lays eggs 3 times. And each time about 100 eggs are laid. And therefore, each mosquito, if you let us say an infected Aedes aegypti mosquito will produce 300 mosquitoes. And what is important again is that eggs of an infected mosquito are inherently infected themselves. So when the larvae and the adult flies are produced, they are infected. They don't need to get reinfected from a patient. Another important point is that eggs can remain dormant, alive, for up to 9 months in dry containers. So if you just dry the container without getting rid of the eggs, it will remain viable for 9 months. That whenever you pour water in that container, this will just hatch and larvae and other flies, other mosquitoes are produced. Regarding the epidemiology of dengue fever, it is a global health hazard, and it is regarded as the fastest spreading mosquito-borne disease. The fastest. And now it is reported from more than 110 countries where the disease is endemic. And endemicity is seen mostly in Southeast Asia and some African countries. This is the orange shaded places are the areas where dengue fever is found. When it comes to Sudan, the first reported case of dengue fever in Sudan was in 1906, and it was reported in Port Sudan. Obviously, this results from an infected Aedes aegypti mosquito arriving to Port Sudan by ships from an endemic area. In 1980s, scattered cases of dengue fever have been reported from different parts of the country. The first outbreak of dengue fever in Sudan was 2005, which started mainly in eastern Sudan, mainly in Port Sudan and Kassala and these areas. During this decade, 2010 to 2019, very big number thousands of cases were reported from eastern Sudan, mainly from Kassala, and this means that we started with one case in 1906, then infection spread, and then we used to report a number of cases in Sudan. The first outbreak was in 2005, but the largest outbreak was in this area, 2022, 23, and it is this time where our local outbreak was declared, as we shall see. When it comes to our area in North Kordofan, the first outbreak of dengue fever was officially declared by the State Minister of Health on this date, on the 22nd of October, 2022. That is 3 years back. However, before this time, a number of cases used to be seen here, but the outbreak was not reported. And these cases used to come from Dam area, Dam Haj Ahmed. It seems Dam is very fertile area for new diseases. A few months back, an outbreak of that poisonous ant causing cellulitis was also started in Dam Haj Ahmed. Since then, since that time, I'm talking about North Kordofan, cases used to be seen. So you said it's the flood of cases. And now, as a resurgence of the outbreak is occurring, and now the number of dengue fever cases in Al Ubaid and in North Kordofan is on the increase. So the question is, are we heading towards endemicity? Is it going to be an endemic disease? Regarding the prognosis, dengue fever is mostly a self-limited disease, particularly where it is endemic. And the mortality rate is 1 to 5% without treatment. When supportive treatment is offered, the mortality rate is less than 1%. Severe cases are seen in around 5% of infected people. So dengue fever is more worrisome, more annoying to patients than being serious. كلام الفرد ده كله كامل. Then كلام عام, then we start the scientific part of it. Pathogenesis. The main pathology is in vascular beds, blood vessels. And as we shall see, as we proceed, the main problem is when these blood vessels become leaky because of the increased permeability. Replication inside cells also will lead to production of inflammatory mediators. Cytokines are released, and these are responsible for most of the clinical manifestations like fever and these things, and complication as well. Platelets are affected in these patients in function and in number, and this is mainly because of bone marrow affection. The other side is bone marrow. Bone marrow is usually affected. Mainly platelets are affected. Clotting factors are also to some extent affected. As we know, most of clotting factors are synthesized in the liver, not in the bone marrow. So these are signs and symptoms. We'll talk about them in details. And again, we'll review this photo again. We'll just summarize the signs and symptoms. Let us talk about the clinical course of the disease. What happens if somebody is infected? طبعا هنتكلم عن incubation period.
تعالي دي محاضرة الآن، بس عجب الدور بالغية في الضمان الآن مباشرة. عن الدنج فيفر، الدنج فيفر حمى الضنك. والله الآن شغالة عم بيجذب.
The incubation period is generally 4 to 7 days. And once infection occurs, this is the clinical course, most of the patients, particularly in endemic areas, are asymptomatic. So many of us now might probably have been infected, but it's asymptomatic. In endemic areas, like in Southeast Asia and these places, up to 90% of infections will just become asymptomatic. However, when symptoms occur, when infection results in a disease, in a symptomatic disease, it might be just in a form of undifferentiated fever, or it becomes a dengue fever. If it becomes a dengue fever, when we cannot differentiate it, is unclassified. It could look like anything. And in most of the time, it will just pass unattended or undiagnosed. Then when it becomes a dengue fever, it's either dengue fever syndrome, or what is dengue fever, the classical dengue fever, or dengue hemorrhagic fever. طبعا dengue fever يا جماعة is part of the viral hemorrhagic fevers. So this is a bit severer form, and some of the patients will progress to shock, what is called a dengue shock syndrome. So this is the clinical phases: simple dengue fever, or dengue hemorrhagic fever, or dengue shock syndrome. In simple dengue fever, you see, the leakage is not a feature. Like when there is a leaking of plasma flowed blood vessels, this is either dengue hemorrhagic fever or dengue shock syndrome. The simple dengue fever, these are the clinical features. The most stable criteria is fever. And the fever is very characteristic, by the way. It is sudden, high-grade fever. This is in contradistinction to fevers like malaria. I usually kept saying, fever is not the first sign of malaria. It has to be preceded by a prodrome. And usually a patient complains of feeling unwell, is fatigued, and then 2 or 3 days later, then fever starts. لأنه we all know in malaria, the fever and the chills and disease coincides with the rupture of red cells. And a rupture of red cells need a couple of days to occur. This is in contradistinction to dengue fever. It has nothing to do with red cells or red cell rupture. So fever can start rapidly, high fever. And by the way, this is why it is, it could be associated with other features like headache and myalgia, arthralgia, and these things. So somebody who is apparently healthy suddenly becomes very ill with very high fever. And this is why it is called dengue. Dengue, by the way, means the evil spirit. Dengue means the evil spirit, يعني الشيطان. بمعنى dengue fever معناه الحمى الشيطانية. الحمى الشيطانية ليه؟ لأنه somebody is apparently healthy, suddenly he falls ill كأنما مسه جن يعني كأنما ضربه شيطان. And this is very characteristic. And it's an important distinguishing feature between dengue and actually many of the viral fevers, they share this feature. Lakin this is not seen in parasitic and bacterial fevers. Bleeding might be part of it. Abdominal pain is a feature. Decreased urinary output. And a very characteristic feature in children is just irritability. They become irritable. كما قلنا, the most important pathological feature of dengue fever is leaky blood vessels. And this is different from hemorrhage, as we shall see. Hemorrhage is not due to increased permeability of blood vessels. Hemorrhage might result from thrombocytopenia and other factors. طيب. Infection with dengue fever serotype would lead to formation of antibodies. And you have 2 types of antibodies. We call them either neutralizing antibodies, and these are protective, which means if the same person got infected with the same serotype, they will not show the disease. But in a non-neutralizing antibodies, this is with regard to another serotype. So if another serotype comes in, the pre-existing antibodies will make the condition even worse. And this is called antibody-dependent enhancement. Then enhancement will lead to more viral replication. Viruses enter other infected cells easily, and this will lead to release of these inflammatory mediators, and then are more severe disease results. Then we move to the pathology of dengue hemorrhagic fever. Well, this is apparently a more severe type. And the main pathology is increased capillary permeability due to these cytokines. And this can result in these conditions, effusions. So effusions is a common site, pleural effusion, ascites, and these things. And this is because of this increased capillary. And this can lead to circularity collapse. And this is the cause of shock, which is a severe type. However, other manifestations sympathetic overactivity, and this is can be seen as tachycardia, vasoconstriction, loss of blood volume, reduction in pressure, and this is important. Yani as plasma leaks out of blood vessels, this will lead to hemoconcentration, and hemoconcentration will be reflected in a form of rising hematocrit. And this why this is a very important finding. You get the hematocrit increases, and also lead to delay in capillary filling. لكن an important thing إنه it's thrombogenic. يعني hemoconcentration can lead to thrombosis and thromboembolic phenomena. Then urinary perfusion is also affected, and this is reflected in the form of reduced urine output and congestion in liver will lead to painful hepatomegaly. If we encounter a dengue hemorrhagic fever case in the critical stage, as I see, it has to be treated as a shock patient, and this is rare. However, an important point is you have to be very rational in giving intravenous fluids. طبعا this includes infused paracetamol. This could be very dangerous. لأنه when the plasma leaks out of blood vessels, it doesn't go outside the body. They remain in the body somewhere. The peritoneum and the pleural cavity and in the gallbladder. And in the recovery phase, as we shall see, this fluid is going to be reabsorbed. So if plenty of intravenous fluids are given, then the patient is going to be subjected to fluid overload. And fluid overload could be dangerous. حياة صغيرة تبدأ شريدة شنو؟ يعني fluid overload is a problem. And it's an important cause of death. لأنه fluid overload will jeopardize the heart function and it will lead to pulmonary edema. So you need to be very balanced in instituting intravenous fluids to these patients. People generally do not die of hemorrhage, as we said. Hemorrhage is not killing. And almost nobody dies of hemorrhage. They either die of shock or organ failures or die because of pulmonary edema due to fluid overload. Usually when there is organ failures, this is the mortality. Single organ 40%, two organs 80%. If you have more than 3 organs, this is multi-organ failure, and this is in shock. It's almost close to 100%. An important point is the course of simple dengue fever is general uneventful. Lakin dengue hemorrhagic fever might progress, might be severe, might be shock. عشان كده it is very important to differentiate simple dengue fever from dengue hemorrhagic fever. But the most important thing, you can have hemorrhagic tendencies in both, in simple dengue fever or in hemorrhagic dengue fever. وبالتالي bleeding is not a differentiating point. يعني لأنه حتى في simple dengue fever you can have things like epistaxis, like hematuria, like blood stools and these things. The mere hemorrhagic features will not make a dengue patient a dengue hemorrhagic fever case. What makes him dengue hemorrhagic fever is the leakage of plasma, not the hemorrhage. And therefore, when we talk about dengue hemorrhagic fever, it has three phases. نتكلم عن febrile phase, critical phase, and recovery phase. Febrile phase, high fever, ممكن some petechial hemorrhages, generalized aches and pains, headache. طبعا يعني head could be generalized headache, لكن very characteristic of dengue fever is retroorbital headache. And the fever usually stands for 5 to 7 days, not more than that. We tell you if you have a fever that lasts for more than 10 days, you have to think of other options. Well, if this ever occurs, it doesn't usually occur in this febrile phase. This is the critical phase, this is second phase. And usually it starts after the fever is over. طبعا that might make a bit of confusion. يعني a febrile patient, when fever is over, he thinks he's okay. But some of these patients are heading towards this critical phase. And this is a phase of complications. It occurs in few people. It lasts for only 1 to 2 days. And the main thing is plasma leak, associated with plasma leak, remarkable plasma leak. وبالتالي there is volume depletion, which might amount to shock. طيب هنعرف بعد شوية شنو اللي بخلينا نقول this dengue hemorrhagic fever and not simple dengue. لكن if you have a dengue hemorrhagic fever, there are warning signs. خليك أنك you have to take this patient serious. And these warning signs, some of them are clinical, others are laboratory warning signs. These are the clinical red flag, the clinical red warning signs. Low pulse pressure, low urine output, delayed capillary filling time, and tender hepatomegaly. The laboratory warning signs طبعا يا جماعة مشكلتنا إنه mostly dengue is diagnosed by exclusion and by certain findings in CBC. دايما الناس بيعاينوا total white blood cell count and platelets. لكن more important than the platelets count is the hematocrit. Then this is the true indicator of leakage. وبالتالي if you are seeing a CBC of a patient, have a look at his hematocrit. احنا قلنا زيادة في الهيماتوكريت more than 20% is serious, very serious. Platelet count is okay. طبعا برضه يا جماعة نتكلم عن functional thrombocytopenia. We are talking about platelet count less than 100. يعني between 100 and 150 is a bit low, but it's satisfactory. The patient will not bleed with this platelet count. Like when platelet count becomes less than 1,000, then this is a significant thrombocytopenia. Very significant if it's less than 50. If it's less than 20 and 30, the patient will bleed spontaneously. Ascites, pleural effusion detected by ultrasonography are important. Low albumin is a warning sign. Low cholesterol is a warning sign. ودي how to differentiate. نحن قبل قلنا how to confirm the diagnosis of dengue hemorrhagic fever. لأنه don't depend on just hemorrhagic manifestations like epistaxis, but there is a number of factors that helps you suspect this is then hemorrhagic fever. لكن it's confirmed only with this. If you see ascites of pleural effusion, this is then hemorrhagic fever. And لأنه these are the true indicators of remarkable massive plasma leakage from blood vessels. The recovery phase, قلنا إنه في recovery phase leaked plasma is going to be resolved back to circulation. وبالتالي if the patient is already overloaded by intravenous fluids, then this will lead to volume overload, ممكن يؤدي إلى مشكلة يعني heart failure or pulmonary edema, pulmonary infarction, and these things. And this is the phase where people die because of problem faced during the critical phase. احنا الناس اللي حصلت لهم مشاكل في critical phase, either because of the disease itself or because of how we manage the disease, these patients will die in the recovery phase. Recovery phase, you know, people, يعني, by the way, one of the clinical feature of recovery phase, important clinical feature is itching. Itching is an important feature of this. Okay, I don't need to talk about shock. Like, as you all know, shock starts as يعني حاجة مقدور عليها, compensated, then become uncompensated, then it becomes irreversible. وبالتالي if your patient is shocked, you have to enter. Now this is an emergency. You should not allow the patient to arrive to the destination of irreversible shock. لأنه irreversible shock, the patient will die whatever you do. لأنه the blood vessels will become very much. لأنه reversible معناه the whole blood vessels are leaky. ما بينفع تدي fluids, it will not raise the blood pressure. ما بينفع تدي drugs لأنه blood vessels are not responding and the patient will die. طيب أنا Torosuke might remember I displayed this same slide 2 years back. مشكلة الملاريا دي. Malaria. Any fever is malaria. Any blood film is positive. عندنا مشكلة. كل الناس ملاريا. وأنا عندي evidences بقولهم إنه نحن over the last few years we witnessed two outbreaks, two epidemics. واحد بتاع الكوفيد 19 and the second one was this of dengue. كل البيشنتس of COVID-19 and dengue fever were initially diagnosed as malaria and they were treated as malaria and they were not malaria cases. أنا would like to give an example. في الضمان ده يعني من قبل سنة وشوية كنا دارين نعين تقنيين في الضمان. عندنا 5 وظائف قدموا لنا 35 تقني عام. فالمعاينة was supplemented ب examination, hands-on examination. الexamination دي في 2 spots of malaria, 2 stations, malaria stations. جبنا blood من دول healthy, تأكدنا إنه healthy, BF negative, ICT negative, هو asymptomatic. نفس الدم ده اديناه اسمين ورقمين وخدناه في 2 stations. الكلام ده قبل سنة فيه معمل الضواني. Out of 35, 33 reported positive malaria. 33. وطبعا نحن حتى those who report positive or ملاريا بعمل لنا الاثنين بوزيتيف بنفتكره برضه كونسيستنت. يعني لو طلعوا لنا اثنين بوزيتيف ده احسن من زول بيطلع لنا واحده بوزيتيف وواحده نيجاتيف، معناه هو ما كونسيستنت، ما عنده حاجه مبني عليها. انا يعني انا ما داير تو اوفند ماي ستاف في المعنى، لكن داير اقول انه البي اف is a difficult test. It is or BF is over diagnosed. نحن اتكلمنا انه يا جماعه depend in our condition depend on ICT. It gives the same sensitivity as a well performed quality assured BF in the best setting which we don't have. طبعا برضو انا talk about what is known as clinical malaria. قلنا malaria is a laboratory diagnosis not clinical, nothing is called clinical malaria. حتى ال WHO classification بتقول malaria is a set of symptoms in the presence of the parasite. يعني without you having an evidence انه there is a parasite you cannot say it's malaria. وبالتالي as I used to say we are malaria loving people. The patient that يقول عندك malaria he loves positive result. الدكتور he loves positive result. الكوبيشنت loves positive malaria results. وكده العيان لو قلت له ملاريا نيجاتيف هيشاكلك، يعني دي شنو طيب يقول لك انا مع عيان and he will go roaming from one laboratory to one laboratory لحد ما يلقى زول يطلع عليه positive and then he feels okay. ف's a problem. طيب another problem is ممكن يكون عندنا co-infection. يعني هل عندنا بس الناس يس يس، لأنه الدراسات حولنا أثبتت إنه ممكن يكون في علاقة other viruses co-infecting patients with dengue. chikungunya نحن زي سنتين لورا تقريبا واحد من طلابنا في المختبرات مشى عمل دراسة عن ال prevalence of chikungunya وفلان قمر الدين كده in الدلن. It was community based، يعني مشى للناس المصاب أخذ لهم سيرولوجي ولقى the result. أنا ما بذكر الأرقام لكن chikungunya was very prevalent. few years back 6 نفر عن others دول من جامعة الخرطوم جو اشتغلوا في الكو-infection between chikungunya and dengue في تندلتي. والريزلت إنه there are few co-infection. أيمن عن إيطال 2015 اشتغلوا في دارفور في معسكرات النازحين، ولقوا إنه والله مع الدنج في زيكا وفي ويست فيروس ويست نايل فيروس. بيبقى السؤال are we having pure or others؟ anyway نحن اثنين الآن من our PhD students شغالين in this area. آدم and عهد are doing their PhD studies in dengue infection in this area. طيب برضو the question of having co-infection between dengue and malaria. It's possible. لكن الدراسات اللي اتعملت في السودان كلها لقت إنه co-infection malaria with dengue is not more than 4 to 5% at most. وبقى حكاية كل الناس عندهم ملاريا ودنج دي it needs to be reversed. Laboratory diagnosis أنا داير أقول إنه if you do a CBC do not only concentrate on platelet count. more important than platelet count is hematocrit. والplatelet count لو ما بقى أقل من 100 it doesn't mean anything. طيب في first 5 days اللابوراتوري diagnosis بيعتمد على antigens. This is one of the antigens or molecular PCR. لكن بعد ال 5 days ممكن نعمل antibody detection serology. طبعا هنا بنعمل antigen detection serology in the first 5 days لأنه يكون there is no enough antibodies to be detected. عشان كده we depend on antigens. طبعا ده زي ال ICT malaria. ICT malaria is antigen detection. We don't look for antibodies. لكن ال ICT dengue كان موجود يفترض أن يكون موجود is antibody detection serology. So it needs a time عشان you have enough concentration of antibodies to be detected. لكن برضو it's fairly sensitive. طبعا IgM is important لأنه IgM معناها إنه infection. IgG ممكن يكون positive في all infection. طيب isolation is also possible. طبعا isolation is culture. Viruses are isolated by tissue cultures. Electron microscopy is a history. Nobody now uses electron microscopy لأنه molecular techniques took over. When it comes to treatment, there is no specific treatment for the infection. So supportive treatment. If the patient is having very severe backache, joint pain, bone pain, headache. I'm finishing that. I'm about to finish. Okay. So supportive. Supportive يعني الانفيوجن. ممكن supportive يعني blood transfusion. ممكن لو عندك coagulopathy you give fresh frozen plasma. And these things يعني. لكن